Did you know that obesity can lead to a more severe case of COVID-19? If not, by the end of this video, you'll understand how obesity puts someone at risk for a more severe COVID-19 infection. I'm Brian Burke. I'm the founder of Rewind Anti-Aging. We work with clients every day that have questions about their health. I wanted to start by saying that my goal for this video is that it might help to motivate or inspire someone who's overweight to lose some weight and to experience better health. This alone would be a huge benefit, but at the same time, it could help someone reduce their risk of having a severe COVID-19 infection. As someone that used to be obese, I can attest to the positive impact that getting in shape has had on my life. The fact that it also might help me avoid a severe case of COVID-19 is a huge bonus that I'm very grateful for. As I looked into COVID-19, it became clear that several populations are at high risk, including the elderly, those that are immunocompromised, and those with underlying health conditions like hypertension, diabetes, and cardiovascular disease. I also stumbled upon the lesser-known fact that obesity is a high risk factor for a severe COVID-19 infection. Unfortunately, this isn't publicized as much as it should be by the media or by our government, but it has been proven in study after study. Let's first start with the definition of obesity. Obesity is defined as having a BMI, which means body mass index, of over 30. Or a percentage body fat that exceeds 25% for males and 35% for females. Severe obesity is defined as having a body mass index higher than 40. In America, 43.6% of all adults are considered obese, and 70% are considered either obese or overweight. As doctors and scientists have been looking at COVID-19 and the impact it's having on our health, the link of obesity to severe cases became very obvious. Studies around the world all support this same conclusion. One study out of Wuhan showed that 88% of the people in that study that had died had a BMI greater than 25. A BMI above 25 is considered to be overweight. A study from France found that ventilation was needed at a rate 7 times higher for obese patients than non-obese patients. In the United Kingdom, a study by the National Health Service's Intensive Care National Audit and Research Center revealed that 65% of COVID-19 patients who were in intensive care were overweight. In America, studies have also confirmed the same link. In one study, people with COVID-19 and obesity were found to have a 113% greater risk of being hospitalized than non-obese people. They also had a 74% greater need for critical care services and a 48% higher risk of dying from the infection. Another study, which was performed at 88 U.S. hospitals taking part in the AHA's COVID-19 cardiovascular disease registry, patients with obesity were more likely to be hospitalized and had an increased risk for being put on a ventilator or dying compared to normal weight patients. This risk progressively increased as BMI rose. Further, their risk of death was 26% higher when compared to normal weight patients. Patients 50 and younger with severe obesity had a 36% higher risk of death compared to their normal weight peers. The study also found that patients with higher BMIs, regardless of age, were at higher risk for blood clots that start in a vein and also for kidney dialysis. These type of ailments can take weeks to months to recover from. Another recent study indicates even the very young people that are obese face an increased risk of having a severe case compared to their non-obese counterparts. This means that all age groups have a higher risk of a severe COVID-19 infection if they're obese. The U.S. Center for Disease Control and Prevention has also confirmed these findings. The CDC found that obese people are more likely to fall very ill with COVID-19 and to be hospitalized, and the risk of death from infection increases along with higher body mass index. So you might be wondering, how can you avoid obesity? And if you are obese, what are some health tips that can help you lose weight? We put together a few of our favorite unique tips and biohacks to help people on their mission to achieve better health. Tip number 1, Don't eat processed foods because they all have sugar and chemicals. Foods such as soda, salad dressing, sauces, bread, cake, and crackers all have added sugars and chemicals and can increase your likelihood of becoming obese. In fact, 75% of all food found in grocery stores contains added sugar. Tip number 2, eat less calories. Figure out your total calories that you burn each day and then plan out your meals to create a daily caloric deficit. In some cases, it might just mean making a simple adjustment like eating one less piece of bread or leaving a couple of bites at each meal or having one less soda or one less juice or one less latte each day or even eating a little bit less sweets. Tip number 3, get out and walk. I'm a huge fan of walking, and I always say to set your goal of having 10,000 steps a day. This just requires a little bit of effort because most people already walk about 5,000 to 6,000 steps a day, and they don't even know that they're walking that much. Walking is also low impact, and most people can do this with very little effort. So get some fresh air, stop watching TV, get healthy, and walk a little more. Tip number 4, don't do too much intense cardiovascular exercise. Cardiovascular exercise is great, but it can be counterproductive if it burns muscle, which can decrease your metabolism. Tip number 5, lift weights to build muscle. Increasing your lean mass can improve your basal metabolic rate. This usually means lifting heavier weights for less repetitions, so check with a trainer regarding your current workout and see what types of adjustments you need to make. Tip number 6, and one of my favorites, is be accountable. Track your workouts, track your diet, keep logs of each, get a fitness tracker to track your steps, and measure your body composition monthly or even weekly. If you feel you might be overweight due to low hormone levels, take a look at our website for more information about our services. We help our clients address their hormone deficiencies, and as a result, many of them find that their health and their body compositions dramatically improve when they begin working with us as we optimize their hormone levels. If you like this video, do me a favor. If you thought it was informative, smash the like button, leave comments, follow us on Facebook, and subscribe to our channel because we're going to have a lot more health-related videos posting soon. I'm Brian Burke, and I will catch you at the next episode.